Hi, this is my husband, Jay. Jay is a nurse at Prosser Hospital. We've been there for 15 years, but we were a nurse before that at other places. What department do you work at in Prosser Hospital?
I work in our outpatient special procedures and doing IV care, IV therapies, and wound care and so forth.
Wound care. What fascinates you about wound care?
Well, I'm a hands-on person, and I enjoy the challenges that some wounds can uh, give us, and the different products that we use for healing, and just how the whole process works, and the dynamics that have changed over the years when you learn about wound care and how it used to be done and how we do things now.
What has changed? How did it used to be done?
Well, it used to be that you would let things dry out and so forth, and they scab over, and you just kind of let nature take its course, and it could take quite a while. But now, with the products that we have and so forth, and we've learned how the body heals and what it needs to heal, we can actually help those wounds heal a lot faster and reduce scarring, and just have better outcomes.
So wounds are not supposed to dry out.
No, your body is a fine balanced machine, and moisture is an important part of that, and that's one of the things we always push with people. Like with burn people, they're talking about hydration and fluids and so forth. Wound beds need to stay nice and moist. There's a balance between being too wet and dry, and that's where we have to continually stay on top of that and monitor that. In order for the skin cells and the cells to heal, we generally heal from the inside out. It's what we call granulation. So you get that tissue that grows up and kind of flattens out, and then skin will grow over that. And it's kind of fascinating because think of epithelialization, skin growth. It has to have a moist base to almost swim across to connect. So that's why we have to maintain the moisture.
So we don't want our wounds to scab over like we've always thought.
Not necessarily, because that's one of the things in wound care that we have to take care of. We have to take care of what's called eschar, which is the scab. And we have to make sure that stuff's off to provide a nice, healthy environment to heal.
So you take care of really big wounds. Someone's not going to come to you for something small that they can take care of at home. So at home, what should we do to prevent our wounds from scabbing, or what ways do we keep it moist, like you're saying?
Well, you can use, they really don't recommend using like Neosporin and things like that for more than maybe 2 to 3 days, maybe 4 days at the most. And then mainly just keeping it covered and protected, and always being aware too, even after that new skin grows, that it's more susceptible to injury until it gets a little time on it, and sunburns.
All right, well, I'm so glad you are fascinated by your job and you enjoy working in wound care.